This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
Hello and welcome to Daughterhood, the podcast. I am your host, Roseanne Corcoran, Daughterhood Circle Leader and Primary Caregiver. Daughterhood is the creation of Ann Tumlinson, who has worked on the front lines in the healthcare field for many years and has seen the multitude of challenges caregivers face. Our mission is to support and build confidence in women who are managing their parents' care. Daughterhood is what happens when we put our lives on hold to take care of our parents. We recognize this care is too much for one person to handle alone. We want to help you see your efforts are not only good enough, they are actually heroic. Our podcast goal is to bring you some insight into navigating the healthcare system, provide resources for you as a caregiver as well as for you as a person, and help you know that you don't have to endure this on your own. Join me in Daughterhood. Supporting someone with dementia is a complex, emotional, exhausting journey. Yet dementia family caregivers face this challenge without the coordinated support, training, or resources needed to provide the best care possible. But that's beginning to change. On July 1st, 2025, Medicare is launching a new, first-of-its-kind program called GUIDE, Guiding an Improved Dementia Experience, created to provide comprehensive, free support for dementia family caregivers. Daughterhood has partnered with PocketRN, an approved Medicare provider for the GUIDE program, and a nationwide organization offering families 24/7 access to nurses right from their pocket. My guest today is Jenna Morgenstern-Gaines, the CEO and co-founder of PocketRN. In our conversation, Jenna will share more details about the GUIDE program and its comprehensive list of benefits, including ongoing caregiver support, education and training, access to respite care. We'll also cover how to enroll, how to find other local GUIDE providers near you, why GUIDE is important. We'll cover it all. I hope you find this conversation as informative as it is timely. What is the GUIDE program?
It is probably the most exciting program that we have seen come out in a very long time because of its intentional focus on family caregivers. So GUIDE is an innovation program that is focused on providing comprehensive and coordinated care for people who are living with dementia and for their loved ones, their family caregivers, their neighbors, anyone who is involved in their circle of care. And for the first time, Medicare is paying for a variety of care management services. So that includes 24/7 access to a care team. It includes ongoing check-ins with a dedicated care navigator. It includes referrals to community supports. And it even includes, for the first time, very excitingly, an allocation of what's called respite care, in-home care, support from a professional caregiver. So all those family members who are caring for loved ones with dementia out there, they can take time for themselves to check in, to do their groceries, to go to the doctor. We know so many family caregivers are skipping their own appointments, are putting themselves last on the list. And this program really aims to give them the support, the relief, the resources, the confidence they need to feel like they're doing the right thing as they are, and they can care for their loved one in the home and keep that loved one healthy at home and as independent at home as possible for as long as possible. And we know many families just want that opportunity to spend quality time together.
Yeah. I mean, that's life-changing.
Yeah.
That's life-changing for a dementia caregiver to be able to have access to all of this, because we know how difficult it is for people to receive even getting the dementia diagnosis, but then we don't get a guidebook. We don't get, do this and this and this. We're trying to figure it out by ourselves. So the advent of this coming in can be just game changing across the board.
Absolutely. Absolutely. And, like you said, Roseanne, just even getting a diagnosis, just being all on the same page about what's going on is so hard. It's a part of the program too, where, folks are going into their PCPs now, their primary care providers, primary care physicians. The PCPs are overwhelmed. Sometimes they are punting the diagnosis to a neurologist, but where we all live, it can take 6 to 9 months to get an appointment with a neurologist. And the truth is, that diagnosis can be done virtually, and it can be done by an interdisciplinary care team. Most of it can be done by an RN with the support from a provider like an NP or an MD, and can be done very, very quickly within the matter of a day or days, instead of having to wait around months to just get that diagnosis, get the plan, know what's ahead, and have someone by your side for that journey.
Really? So tell me about that. Tell me how that works, because I know there has to be an eligibility requirement for guide. What is that, and what does that look like?
Great question. So the most important, there are 2 elements of eligibility. The most important is that you have a suspected or confirmed dementia diagnosis. And the second is that you have Medicare Parts A and B as the patient, as the individual who has dementia. So this is for traditional, what's often called traditional Medicare, not for Medicare Advantage, at least not yet. Mm-hmm. Now, going back to piece number 1 about the dementia diagnosis, many folks come to us knowing that their loved one already has a dementia diagnosis, but some are just seeing signs and symptoms of cognitive decline, maybe losing their keys more often, getting lost on the way home, little signs and symptoms that suggest that dementia might be at play, but there might be resistance to getting a diagnosis, or there may not be an ability to get that diagnosis because your PCP doesn't have the background to do so, the willingness to do so, and you can't get in with a neurologist. And so what the very first step in guide is called the comprehensive assessment. And during that comprehensive assessment, if you're a member of the PocketRN guide program, you will meet with a nurse who walks through a variety of established tests to validate whether you do indeed have a dementia diagnosis or not. And they also do a variety of other analyses. So they'll do a caregiver burden assessment to understand what the caregiver specifically is going through, which is obviously tremendously important too. And so through that comprehensive assessment, a nurse who is supervised by an NP or an MD will review all their medications, review all the medical history, go through the mini mental and fast assessments to understand whether there's a dementia diagnosis or not. And then that assessment is submitted to CMS, to the Centers for Medicare and Medicaid Services, and CMS will confirm or approve that diagnosis and then enroll the patient and their family in the program. And that can be done all virtually, which is very exciting in terms of our ability to improve access to care and get people enrolled in a program like this.
That's amazing. I mean, that's really amazing. And the fact that this is a first of a kind where the caregiver is being treated as part of the process, because we all know we're part of the process, but now it's finally caught up to be like, hey, we can support you too. This program started, where did this come from in Medicare? Because, Medicare is very reticent on paying for any kind of home care, anything. Where did this come from? And it started last year, right?
That's right. Yeah. So the program is housed within the Centers for Medicare and Medicaid Innovation, CMMI, within CMS, which is uniquely tasked with developing innovative programs, new care delivery models to solve unmet major medical needs and conditions and afflictions that are tremendous cost and burden to the system. And it's been a long time coming. There were 12 years running now, I think, the National Action Plan for Alzheimer's through 3 different presidencies is a bipartisan effort that in many ways spurred the creation of Guide. There were a number of evidence-based trials and programs that came out of UCSF and other institutions that that really formed the care domains for the model. And so it is, essentially a demonstration. It's an innovation program to be able to show at the end of the day that the guide model in different forms, and different providers have different takes on the guide model. Our take is a nurse for life plus home care plus education and training and resources from organizations like Navan and Daughterhood, that combination, that cocktail is what will keep dementia patients healthy at home for as long as possible, which reduces cost, improves quality, gives families and patients that time back together. That we will prove that by the end of the program, and throughout various junctures, and already to date, all the data that we've seen in academia supports it. So it's a unique part, which gives it a very, means it has very strong bipartisan support through multiple different presidencies. It has a unique budgeting mechanism that funds the program, and it is designed to be innovative and different because of the gaps that exist.
Okay. And beginning last year, it was kind of like I don't want to say training, but it was kind of a slow roll to get to this point, to get to July 1st. Is that how it went?
Right. So this is an 8-year program. July 1, 2024, was the beginning of the program. And that was between July 1, 2024 and July 1, 2025, what was called an implementation year or a pre-implementation year for some of the providers. So there are different types of providers in the guide program. There are established and there are new providers. Established providers tend to be more local health systems, some neurology clinics. They are older institutions that have 5 to 10 years of, but likely more, of experience delivering dementia care, typically in a hospital or even a hospice setting. And so those organizations launched on July 1, 2024 as part of the established track. Okay. Anyone that's in the new track, which is the majority of the organizations, starts officially July 1, 2025. And then 7 years of formal implementation. But we have been PocketRN went live for that implementation, that pilot year in July 1, 2024. So we've been trialing the model for the last now 10 months. And that has helped us iron out kinks, workflows, figure out what works, what resonates. And then come, July 1, 2025, that means we have a lot of ducks in a row already as it relates to the requirements of the program.
Okay. I know we talk about finding a provider, a local provider. How do people find that?
So, and it's not currently super straightforward. I will admit. So there are providers all across the country. PocketRN is one of the few national providers serving all 50 states. You can go onto Google and you can Google CMS Guide Dementia Care Program, and you'll pull up a link and it'll show you a list of all the providers in the program and providers that are in your area. I will say the list is not always accurate. There are some states that say there are no providers where that is currently not the case. And CMS and CMMI, I give a lot of credit to, because they're doing a fantastic job keeping up with all of the inbound and all of the updates and information they're receiving from the participating organizations. But it does mean there are delays or sometimes inconsistencies in terms of the list of providers and where they're all present. So right now we're seeing family caregivers, as they often do some digging and try to find out who's available in their area. One thing that's very easy for us from a PocketRN standpoint is that we're available in all 50 states. And so it's very easy to get in touch with us just via our website and our contact form. Otherwise, I would recommend folks try and keep up to date with the CMS website and reach out, even if it seems like a provider is not in your area, but you like what they do. It's worth just double checking when you have the time.
Okay. As part of the qualification, you must be either in your own home or in your care partner's home. Is that accurate?
So you have to be living in a home or community setting. So you could be living in your own home. You could be living in a family member's home. You could be living even in assisted living, even in memory care. You can't be receiving long-term skilled nursing care. You can be in a SNF or subacute rehab facility for a short period of time, maybe because you've gone to the hospital and you've had a SNF stay after the fact. So there is a little bit of openness there. You could be living in independent living, of course, assisted living, memory care, and still receive this program. And we see a lot of families that really have the goal of trying to keep and wanting to keep their loved one at home together for as long as possible. And we know that won't be possible for everyone. We know there will be people who will have to go to independent or assisted living or who won't have family members around to take care of them. And like they do their best. But our goal with Guide and with PocketRN is really to help families still enjoy the good days together and have the support for the bad days when they do come. And so that's really what I think the power of Guide is in really helping keep families together and giving them more quality time back as they go through these really difficult changes. And they're constantly asking themselves, we all do, am I doing the right thing? Am I doing enough? Could I have done something differently to change the outcome? And the pressure that family caregivers put on themselves to be clinicians, to be a PCP for their loved one, to be a care coordinator, care navigator is tremendous. And that's not their job. That's what we're here for, right? That's what your nurse for life is there for. So you can just let family members be family members and do what they do best.
That it's not our jobs, but it becomes our jobs.
Exactly. Yeah.
And to be able to have, for me, this is a safety net. I think of, wow, that's something that can actually help you to not just survive your caregiving journey, but to be able to finish and still be okay. Listen, the caregiving experience changes you. It has to. You're not the same person that you are when you start to when you finish. You're not. But to have this type of support throughout can really change your life. And even the caregiving education, the caregiver education that you provide, because when you call the doctor and you say, she's up all night or she's wandering or she's got, behaviors or rage or whatever, that's not their job to be, well, this might be a behavior that you could try to tailor. That's not what they do.
Right.
The information that you provide and education to try to counteract that can make all the difference. I know you said Navon has the caregiver education piece. Can you talk a little bit about that? What does that look like?
Yeah, it's a great question, and I completely agree. And it's all those you see your PCP, your provider for physician, maybe once a year, maybe twice a year. But what we're really talking about is supporting in those little moments, the day-to-day care, week-to-week care, the questions that come up. And the Navon platform is phenomenal. It's a combination of videos, of other types of content. It's very engaging, super, super easy to use. And every day the content library grows. And so it's phenomenal to even see, how responsive the Navon platform is to how family caregiver demographics are changing over time, and different languages. It's available in at least 14 different languages. So there's really a wide array of content, but it also doesn't feel overwhelming. It doesn't feel like you just have this library that you have to sift through. It's very easy to navigate. You can search within it. And so, what is beautiful about Navon and our partnership there is, a lot of the time, your nurse for life will be in a conversation with you as a family caregiver, and will say, there's a fantastic Navon module on agitation or on waking up in the middle of the night, and on aggressive behaviors that I want to assign to you. And I want, it's up to you, of course, whether you want to watch it or not, but I found it super helpful. And it's 5 minutes, when you have some time, take a minute and check it out. And, we find that on average, the dementia caregivers, family caregivers are using that platform 16 times the average caregiver, because they just have so many questions happens. There's so many changes, you wanting to understand whether something is normal or not, and then have the tools at your disposal to try and address or manage it as effectively as you can. There are a lot of tried and true techniques out there that nobody gets a playbook or a guidebook, like you said, Roseanne, at the beginning of this journey. And so, people just don't know what to expect, and they don't know that there are actual tools that can help them. And so there's a feedback loop where, nurses can suggest trainings and education and content to caregivers, and then caregivers might also find it on their own, and sometimes they'll bring it to a conversation with their nurse for life and say, oh, I saw this really interesting, module from Navon about sundowning. Can we talk about that, a little bit? I wanted to learn more. And so there's a closed feedback loop so that, if the video gives you a general overview, but you need something that's more personalized to your loved one, you can get that feedback as well from the nurse. So it's a really great closed loop system.
And those videos are, I've watched quite a few of them. They're spot on and easy to follow, easy to find. It's really a great system. And, take me through this. I'm a dementia caregiver. I see that PocketRN has a partnership with Daughterhood, and I think, all right, let me call and see what happens. I call the number. What happens?
Typically what happens is, you'll call the PocketRN support number. It's on our website, PocketRN.com. You could also write to us on our contact@PocketRN.com email. There's a form online.
It's under the Dementia tab on our Daughterhood website.
Yes, exactly. Yep. So you can find it from multiple different avenues. What will happen is a member of our team will reach out to you, or if you call in, we'll patch a member of our guide liaison team into a call with you. They will ask you a few questions just about you and your loved one, a couple screening questions, understand your insurance situation. As we mentioned, you have to have Medicare A and B as the patient in order to qualify for guide. And we can check your eligibility on the back end using our own system. And very importantly, I stressed this earlier, but very important to stress that guide is absolutely zero cost to patients and family caregivers. It is fully federally funded. There are no copays. There are no costs whatsoever associated with the program, but you do have to have Medicare A and B. And so our guide liaison will walk you through that to help you understand a little bit more about the program and how it works. And providing that you are indeed eligible, then we will schedule or patch you into a comprehensive assessment with a nurse. And that nurse will go through the assessments we talked about earlier to see whether your loved one qualifies for the program.
Okay. And then after that, you have a nurse assigned to you, I'm assuming?
Yes, that's right.
So in the middle of the night when something is going on, you can access this nurse.
Yeah. So you have a dedicated nurse for life, and that nurse for life is proactively checking in on you on a regular basis. And our care team is also available 24/7. So if you have a question in the middle of the night, it'll first get routed to your primary nurse. If that nurse happens to be off shift at that time because they're sleeping, there is a backup team of nurses who have all of the same information. They know that if you talk to, Nurse Jenna last, they have all of the notes from that last conversation. They'll say, hi, I'm Nurse Troy. I know that your nurse is Nurse Jenna, and I'm here to see how I can help, and I'll coordinate back with her. I'll also coordinate back with your PCP, your other providers, if they're involved in some facet of your care. And so you have your dedicated nurse for life, but you're not only serviced and helped by that one nurse. You have an entire team, a care team behind that nurse to support. And this is really important as well, because we know that dementia is rarely it, quote unquote. Many patients who are in the program have dementia, but they also have COPD or CHF or diabetes or other challenges. And so we have a team of specialized nurses that can help and consult and work together in a team-based care setting to address all of the different challenges that a patient and then therefore their family caregiver might be facing and managing. And it's it's hard to know sometimes. Is it delirium? Is it a UTI? What exactly is going on? And so, that's why it's really important that we have that 24/7 care team available. I will say though, I think 80% plus of the interactions on our platform and part of the program are through those proactive check-ins, because the family members really value having that regular touch point. And sometimes, it takes some time for them to, we see it a lot that, family caregivers don't want to burden clinicians. And we always encourage, that is what we're here for. And that is the way this program is structured, which is fantastic. So if anything happens, we want you to call. We really want you to call, and we'll talk. We'll be there. We won't just be there for 2.5 minutes. We'll be there for 30 minutes, 45 minutes, an hour, whatever you need. We're here for you.
And this is not, just to be clear, this is not in place of a primary care physician. It's an accompaniment to all of the care that you're already receiving. It's support for the caregiver.
Exactly right. And, PCPs are so strapped. Primary care physicians are so strapped today. And like you said, it's often not these are often not the questions that they're comfortable addressing, and that they have real time to spend, with you and address. And so, it is an accompaniment. It is meant to be the glue. It is not meant to fragment care any further. It's meant to connect those dots, connect the pieces, and augment the support that you're receiving, because we all know, I neglected to share this earlier, but, literally 100% of all patients and family caregivers that we have introduced to Guide have signed up, because they all recognize that they need more help and support, and there just isn't enough in the system today for them.
Yeah, it's a no-brainer.
I just wanted to also touch quickly on the stigmas that we're all very familiar with around, not knowing whether you're doing the right thing, feeling dumb, feeling like you should be on top of this, and you're not. And, the only thing that we all, and everyone listening to this I'm a family caregiver, you're a family caregiver, Roseanne, everyone will identify with those feelings or similar feelings, knowing not everyone is the same. But the only thing that we can really liken it to is the experience of being like a new kid in school, where you've shown up for the first time. You're lonely, you don't have any friends, you're confused, you're embarrassed, you're trying to make it seem like you know where to go. And someone from your class reaches out to you and says, let me help you. Let me take you to homeroom. Let me take you to your next class. You can sit with my friends at lunch, and I'll show you the ropes, and I'll be here for you. And that's exactly what the Guide program does, and what a Nurse for Life does, because families get bounced around. They feel lonely. They feel confused. They feel embarrassed. And having someone just there to reassure you that you're doing the right thing, and I'm going to walk with you through this journey, and we're going to navigate the ups and downs, and I maybe have a little bit more knowledge of how this goes, and I can guide you, and you're not expected to have that knowledge, but I'll be there for you throughout the journey. And I think it's so important, and I love the work that Daughterhood does to try and destigmatize the feelings that family caregivers have, because they've been ingrained in us over years and years and years, and they're hard to quash. But first and foremost, recognizing that they're normal, and that we have them, and that there is help out there, and that it's okay to take it, I think so important. So I really appreciate all the work that Daughterhood has done to try and really address those issues.
Thank you. It is the unspoken thread of, and yes, of course you feel this way. How could you not feel this way? And it's like being thrown in the deep end. When you talk about the respite benefit, which is a game changer, can you tell me, does that just, okay, I want respite? Like, how does that work?
The respite benefit is a total game changer. And it's the first time that traditional Medicare is reimbursing for home care, which is huge. And it is one of the things that family caregivers need most. Unfortunately, we see that the respite care kind of just brings people back up to baseline. Family caregivers are skipping their own appointments. They're not able to go to the grocery store. They're not able to see any of their friends or family or anything like that. And so the respite care gives them a little bit of time back, and that's fantastic, and a little bit of relief. And we do find that caregivers are at their breaking point a lot of the time, when they come into our program. We had one caregiver say that she felt like running away, and then she was able to get the respite care, and she was able to go see a friend and spend some time away, and that made a huge difference in her confidence and her motivation and her ability to keep moving forward, and keep caring for her loved one the way that she was. So the way that it works is, you have to, as the patient in the program, has to have moderate to severe dementia, which is based on that assessment that we do at the outset, and they have to have an identifiable family caregiver, and that definition is quite broad. So it could be someone living 3 hours away from his mom as a caregiver. It could be someone who lives out of state. It can be somebody who lives with you. It's your neighbor. It could be your neighbor. It's really variable. So so long as there's, and in almost all cases, we're able to identify somebody that would qualify as a family caregiver. And frankly, most of our beneficiaries in the program have moderate to severe dementia. So about 75% today qualify for respite care. So those are the conditions that need to be met. And then there's flexibility in how the caregivers choose to use that respite care. It needs to be used if you're using it for home care, as in having a professional caregiver come into the home, you have to use it in 4-hour increments, but you could use it, on a recurring basis every week. You could use it for a weekend. You can choose, you have flexibility in how and when you use it. And we work with the family caregivers to figure out how to best use it. We have some caregivers that they resist it at first because they feel like they're failing if they're using the respite care. And we have to encourage them that no, the point of this is so that you have the energy, you have the support, you have the relief to keep going. And it's not failing. It's something you deserve and something you've earned throughout your many years of caring for your loved one. And so, maybe just to tell a quick story, just to illustrate how you can use the respite care differently. We have a couple who's in the program. The wife has dementia. The father, the dad is her primary caregiver, and the two sons live far away, but they're involved in her care. And one of the sons was getting married, and they were all very worried that they were not going to be able to attend the wedding. The parents wouldn't be able to attend the wedding because the mom's condition was increasingly progressed and she needed support. And so we were able to get them enrolled in the program. Their nurse for life gave them tips, tricks, tools about how to manage a flight, how to manage a new environment, and a professional caregiver was able to go with them to the wedding. And they used the respite care over the course of a weekend, or most of it over the course of a weekend, to be able to attend that wedding. And that family was able to have that moment together that otherwise they would not have. So that's one way that we've seen it be used. That was really, really meaningful.
That's amazing. I mean, that's great. Well, and it's so hard too to bring somebody in if you don't feel it's hard, one, to acknowledge that you need to bring somebody in, and then it's hard to get somebody in, and then you want them to be trained in dementia, because you don't want, in quote, a regular just caregiver to come in. They need to be trained. Like, we're all trained at this point.
Yeah.
Right. We know what we're looking for. We know what's happening, and we still are off balance. So we need somebody that's trained. Are your partners, do they have trained dementia caregivers?
Yeah, it's a great question, and now not all of our partnerships have been made public, but we have partners who help deliver that respite care all over the country with amazing professional caregivers. All of them have a very strong focus on quality and training. So even in places where training is not a requirement, they have training for their professional caregivers, which is fantastic. And a lot of the time they are dementia trained, or they are already an existing caregiver of a client or a patient and their family. And so there's an existing relationship there. And so that also helps to smooth that trust. But it's also the other thing that I think is really helpful in addition to the training, because you as a professional caregiver do deal with special circumstances when you're trying to support a dementia patient. Is that the nurse for life is also there to support. So if anything goes awry in the moment, and if there's not a good fit, usually we've already sussed this out in advance, but if for whatever reason there's not a good fit between the professional caregiver and the patient in the moment, Nurse for Life is a familiar face that is there to help kind of bring some calm down to the situation, and guide the professional caregiver in that moment. And so that really is the glue that holds a lot of this all together.
You've covered all the bases.
Thank you, Roseanne. No,
you really have.
We honestly, like you said at the beginning, this program is. People ask us what's the catch, because it seems like a real win-win-win, and it is, for the families and patients to get that coaching, for the PCPs, for the other clinicians involved to get the additional support and coordination. It really is a fantastic program. CMMI has done a great job designing to improve quality and lower cost to the system, and give families those little moments and that quality time back together.
I want to circle back for 1 second. At Daughterhood here, we are thrilled to be a partner with PocketRN. Can you tell me a little bit about PocketRN and how you got involved in the guide program? Can you tell me a little bit about that?
Yeah, first of all, I'll just say that the feeling is mutual, Roseanne. We love being partners with Daughterhood, and just have so much respect for the human-centered work that you do for family caregivers, really understanding their experience and providing them the actual resources they need on a tangible level, not just at the highest level. And so we've always had great respect for Daughterhood and your phenomenal work. So we're so grateful to be partners, and so grateful because we really want our patients and family caregivers that are part of this program to be well aware of Daughterhood and the resources that you offer and provide. So
thank you.
So thank you. And just to speak a little bit in more detail about PocketRN. So we are, as I mentioned, one of a select number of guide participants. So you had to apply to get into guide. It's an 8-year program to start, and the idea is that it becomes formally certified permanently as a program thereafter. But if you applied and got in, you're in. If you didn't apply, or you applied but didn't get in, unfortunately, there's no more window to participate. So there's only a limited number of providers.
Okay.
The reason that we received the award for guide is because of our Nurse for Life model, which for years we've been building, and has focused on providing a dedicated, specialized nurse to older adults and their caregivers as they navigate the complexities of care in the home for the rest of their life. And we do that in very close partnership with our home and community-based services partners, and other healthcare providers across the continuum, to be able to really be that glue for patients and their families. And as you noted, a lot of our guide partnerships are in that home care space, to be able to deploy that respite care all across the country, but also because we really value the work that those home care providers are doing on the ground. They are the eyes and ears, and we're trying to really build a coordinated, comprehensive care model that extends from the ground up. And that, includes everything from that Nurse for Life who's providing continuous education, emotional support, tools, advocacy, really becomes a trusted care partner to you. And that person is checking in on you. This is the same nurse that you're building a relationship with. They're checking in on you every month or even every other week, depending on what your needs are, to make sure that, we're following along with that care plan that we built at the beginning together. Sometimes so much of this is just about knowing that there's a plan and knowing that the plan might change, and knowing what might be coming, and then having somebody there with you when the unexpected arises and when things do change. And so our model is really centered around that nurse to patient and caregiver relationship. Mm-hmm. And that nurse takes on a lot of the different what are called guide care domains. So that regular monitoring, 24/7 access to care, coordinating referrals and community supports. We also, I'll add one last unique thing about our model before wrapping up. We also have tremendous caregiver support resources through partnerships like with Daughterhood, and a partnership that we have with Navon that provides best-in-class family caregiver education and training. So instead of having to resort to Google and ChatGPT, you have peer-reviewed and best practice dementia education, and that's in bite-sized format for family caregivers to learn from and to look back at as they go through the journey. So those and what we found in that model is that we're able to reduce emergency department visits and hospitalizations by 30% plus. We're able to generate significant Medicare savings and out-of-pocket savings for patients and families. We know caregivers spend so much money caring for their loved ones, and often at 11 p.m. on a Friday night when something's going wrong, the only answer you have is let's go to the emergency department, and that can lead to increased frailty for your loved one, and it can lead to having to move them into an assisted living facility or having a short-term stay in a SNF. And so those are the kinds of things that our model has been proven to avoid, and now Guide is validating and funding such an innovation program, which is so exciting.
It's fantastic, and I don't know. I mean, I don't know. What would you tell a dementia family caregiver who sees this and thinks, I don't know, is this worth it to me? What would you say to them?
I think what we emphasize, and what I would particularly emphasize to family caregivers, and being a family caregiver myself, is that you're already doing so much. You are doing the right thing, and this is a way for you to get that little bit of extra support that you need, so that you don't have to be a nurse in a family caregiver's clothing, and you have somebody who's going to advocate for you, and you have somebody who's going to coach you and be with you through that journey. Because if you're a family caregiver, you know that you're the one that is coordinating between all the different clinicians that your loved one is seeing. You're the one who's repeating information over and over again. You're the one that is checking to make sure that this medication doesn't have side effects with that medication. And you don't have anyone that's really there with you throughout the journey for your life, for those little moments. Like you might think your PCP does that, but we all know that we get maybe 15 minutes with them a year, and you leave with more questions than you entered with. And it's really hard. And it's not, and this is the first time that a program exists specifically for you, where there is someone who is one-to-one there for you throughout the journey, not there for your PCP, not there for the health system, not there for your insurance company. They're there for you, your advocate, your coach, your supporter. And that's what is really, truly unique about this program. And so that's what I would tell them.
A big thank you to Jenna Morgenstern-Gaines for being my guest today. To learn more about the Guide program, all of its benefits, how to enroll, more information about PocketRN, and how to find a certified Medicare Guide provider near you, visit daughterhood.org and click on our new Dementia and Guide tab. I hope you enjoyed our podcast today. Head over to daughterhood.org and click on the podcast section for show notes, including the full transcript and links to any resources and information from today's episode. You can find, subscribe, and review us on Apple Podcasts or anywhere you listen to your podcasts. You can also connect with us on Facebook and Instagram at Daughterhood. There you can discover our various circles and subscribe to our newsletter for updates. Feel free to message me on any of these sites and let me know what issues you may be facing and would like to hear more about. Or even if you just want to say hi, I'd love to hear from you. Also, a very special thank you to Susan Rowe for our theme music, the instrumental version of her beautiful song, Mama's Eyes, from her album, Lessons in Love. I hope you found what you were looking for today. Information, inspiration, or even just a little company. This is Roseanne Corcoran. I hope you'll join me next time in Daughterhood.